Hi guys, I have my friend Adrianna Ribeiro here. She is a registered nurse and she works in an emergency department at a hospital, and she's currently a student to become a nurse practitioner. Can you tell me a little bit about your field and what your plan is to become a nurse practitioner? Yes.
Yeah, so I've been working in the ER for about 2 years now. I want to become a psychiatric nurse practitioner. Oftentimes in the emergency department you'll see a lot of need for psych. And so I want to sort of bridge that gap as a nurse practitioner. It's something that's really lacking in the field right now. And I want to give back to my community and to my patients.
Awesome. So I decided to do my project on the Patient Safety Act that was going on and it didn't pass. So currently I am a licensed practical nurse and I am going to school to become a registered nurse. So the topic I wanted to talk about was the Patient Safety Act, because when I do become a registered nurse, I could possibly end up working in the hospital, and that's something that could affect my career. So currently the American Nurses Association, which is a professional organization to advance and protect the profession of nursing, was trying to pass a ballot on nurse to patient ratios. Can you tell me a little bit about what they're trying to do?
So basically, question one was about patient safety. The Nurses Association spent a lot of money on this question, and unfortunately it didn't pass. I'm definitely a vote yes. Basically we wanted to implement a law that would tell you exactly how many patients you could have in the emergency department, in the maternity unit, and all different places of the hospital, to ensure, that things are clean, that we're giving enough attention to our patients, to avoid death, to avoid any mistakes in patient care, and just overall to improve it.
Now, with you currently working at an emergency department, do you feel like the hospital needs these ratios?
I do. I can see why it would be a good thing and why it would be a bad thing. So I'm mostly was a vote yes, since it didn't pass. I keep forgetting that this is the past. So I'm mostly a vote yes, because sometimes we get too many patients and I feel that we can't properly care for them in the way that we would like to. So this might lead to us delegating tasks to, say, an LPN or to a PCA or something, when it's really a task that should not in any way be delegated to them, because we just don't have enough time and we have too many patients. So I mean, it can be bad to put the patient limit, because what if we don't have enough nurses? Then how are we getting through all the patients that we need?
Exactly.
So I mean, there's definitely ups and downs to both sides.
Now, do you feel overwhelmed with your assignments? Like, do you feel like you're getting burnt out?
So luckily for me, I work at a major hospital, and I feel that they're very good about delegating the amount of patients, but I know a lot of nurses who work in hospitals who don't have that sort of strict delegation. It really is facility based, and it should be standardized. I have a lot of friends that are overwhelmed, and they've seen awful things happen, like overdosing of medication or
Medical errors.
errors. And I'm sorry, did I answer your question?
Yes.
Okay.
And is this only for the hospital that the ratios would be implemented, or is it everywhere for nurses?
As far as I'm concerned, it's really focused on hospitals, but then again, you have to remember there are other places that nurses work, so in nursing homes or rehabs, and that's something else to think about as well, because if we vote yes, that's restricting, that's a money issue. So in nursing homes, there are a lot more CNAs, there are a lot more new nurses, and they're paid less. And so if you think about how many new nurses we'd have to hire, then we're not able to take as many patients in. And so where are these patients that don't have enough money to maybe go somewhere with more nurses? Where are they going? They're stuck waiting. What are we doing with them? So I mean, that's a no. But then yes, because we're preventing infection by paying more attention to the patient, which leads to less patient death, less errors. So overall, the patient's safer, healthier.
Exactly. So one of the concerns I heard was that the need for nurses. Do you feel like the hospitals are just not wanting to hire more nurses, or do you feel like there's not enough graduating nurses to put in hospitals?
I think that they're picky about who they hire, and they could hire more. I think the vote no is more of a scare tactic from administration because they don't want to pay more nurses.
So how do you feel about the law not passing on November 4th?
So, of course, I'm upset because I did vote yes. Although I can see the argument for both sides, like I said, I really do think that no was just a scare tactic, and I think people did a really good job at scaring the public into thinking that this would create some type of catastrophe amongst nurses and hospitals and the community. So I'm really upset about that. If you think about it, let me just give you a really simple example. A UTI. That is a huge thing that people get when they're in the hospital, especially elder people, and you can get that from catheters and things like that. If you think about the amount of patients that have those, I mean, it's a lot. And a lot of people are getting UTIs from those things. And the way to prevent that is by taking the urine bag and moving it from different sides of the bed and making sure that the patient is mobile. So if you have too many patients and you have a lot of other things to think about, like medication, maybe someone's bleeding, their IV is infected, you need to change it, somebody's throwing up. I mean, there's just so many things. How are you going to remember to take a urine bag and move it from one side of the bed to the other side of the bed? Such a simple thing to prevent a UTI, but we just don't have enough time for it. That's just one simple example. Hospital-acquired infections are rampant, and when people look for a hospital to go to, they're like, which one's the cleanest? Well, I mean, they could all be the cleanest if we had patient limits, because we could pay more attention to those things, pay more attention to little minuscule things that if we had more time, we could fix. I mean, wouldn't you want safer circumstances for your grandmother, your mother, yourself, your children? Voting yes was the way to go, and unfortunately we didn't do that. But I don't think this is the last time we'll see the question on the ballot. I think we'll see it again, and I really hope that because of the attention we're getting, that there will be some changes, maybe, just in one or two hospitals, but any change is going to be a big change.
Thank you for taking the time to answer my questions, and
I hope that helped.